Sexually transmitted diseases, otherwise known as sexually transmitted infections, are also venereal diseases. Sexually transmitted infections over time become an STD when symptoms begin to appear. However, when you see symptoms, please seek medical advice immediately. It is very important. In the lower right quadrant of the slide, you see male and female genitalia that demonstrate some STDs present on the body. And in the middle of the slide, you see female that present other common STDs on the body. Now, in the middle picture of the slide, those STDs, as you can see, have obviously remained over time actually too long, and they progress, and they can also spread. Now, you can receive an STD or STI through sexually intercourse from either vaginal, anal, or oral contact, or some type of exchange of bodily fluids. This slide is a list of the most common STDs amongst high school students: chlamydia, gonorrhea, herpes, or syphilis. Now, it's estimated that 3 million teenagers are infected annually, and that is a lot. 3 million teenagers, that is a lot. And many of the diseases listed are treatable if they are diagnosed early. However, previously discussed, if they go untreated for a while, they put the teens at further risk for health problems. And women, chlamydia can cause pelvic inflammatory disease, and that is a very painful disorder, and that can also cause infertility. And gonorrhea can make it easier to contract HIV, which is the virus that causes AIDS. Now, 47% of high school students have had a sexual intercourse, and only 41% did not use a condom the last time they had sex. Now, nearly half of the 20 million new STDs each year were among young people between the ages of 15 to 24 years old. That is the age range between junior high to graduating high school students. So that is very important to always protect yourself. And nearly 10,000 young people between the ages of 13 to 24 were diagnosed with HIV infection in the United States in 2013. Yes. So in the this picture present on the slide shows ways of how these STDs can be contracted. It shows ways for each one of the most common STDs and the different ways that you can contract it or spread it from sexual intercourse, unprotected intercourse, bodily fluids, or just skin to skin sexual contact. So it's important to pay attention to that. This slide is a slide that shows symptoms of what STDs look like on male or female body. The symptoms that occur between a male and female regarding STDs or STIs are similar. You can both receive some type of discharge, and if it's an irregular smell or color, that is not normal. If you can also receive blisters, sores, or warts, and they can sometimes be painful. You can also receive pain or burning while urinating. And if you see or notice any one of these things, please seek medical treatment immediately. I apologize for the picture to the right, the clarity, but I wanted the audience to be aware of what these symptoms look like present on the body. As you can see, you see a picture of female genitalia with discharge and genital warts. You also see a picture of male genitalia with warts and discharge, and that gives you a slight idea of what these symptoms look like appeared on the body. These two clips show images, show statistic and graphs of STDs presenting in male and females and are actually on the rise annually, sadly but true. Um, Gonorrhea and chlamydia tests are the most common because those are the most contracted till date. And these tests are the most commonly done in high school for students in grades 9 through 12. And right now are at three high schools serving approximately 2,000 students. And that is great. And I think that we should continue and actually spread prevalent tests amongst high schools. Now, 90% of the students found to be infected on their first test had no symptoms or signs of an STD. And as previously stated, an STD it, symptoms appear slower in males than they do in females. And that's why I stress that it's important to practice safe sex because over time, as you've seen in the previous slides, and the STD worsens and it can cause a lot of damage, not only in your reproductive organs, but also in your body internally and externally. Now, as time progressed, the numbers have actually tripled for the amount of girls and boys who have received chlamydia and gonorrhea amongst high school students. Contraceptives are very important while practicing sex. They actually make sex safe and believe it or not, better. And the reason I say better is because when you're knowing that you're being safe, it increases the enjoyment. Now, contraceptives can include condoms, birth control pills, an IUD implant, which is implanted in the women's cervix area, which allows sperm cells not to get in contact with her eggs, allowing the female not to become pregnant. And then you also have the birth control shot or the birth control patch or the birth control ring for women. The most common contraceptive to date is the condom, and that is 59.1% of all teens ages 15 through 19 uses the condom. And then the second most common amongst women are birth control pills. And it is highly suggested that you use a condom while protecting sex because it lessens the risk of you contracting a sexually transmitted disease or infection. However, practicing oral sex, they do have oral condoms that you can purchase. During this class activity, I bought germicide. Is safe. It's not potent, and when you wash your hands, you can quickly remove it. When if you wash your hands with soap and water, and during this activity, this would just explain the importance of practicing safe sex and how quickly it can spread from one person to another person. So during this activity, I will put germicide on both hands of each student. I want each student to go around and shake each other hands. Shake each other, either one person hands. I will turn the light off and I will pull out a UV light. Now, some students have germicide and some students do not have germicide. However, everybody does not know which students have the germicide and which students does not have the germicide presented on their hands. And you can also it's also not visible once you put it on your hands. Now, when I turn the light off, I will put the UV light over everybody's hands, and when you see a orange glow appear, that means that you have been infected. And as you can see from the amount of students that have been affected, this lets you know how easily it is to contract an STD without practicing safe sex. Now, let's say, for instance, we wore a glove. We had the germicide on our hands and we wore a glove. What are the chances of us receiving an STD? They are slimmer because we were safe. We were protecting our hands. So, once again, students, it's always important to practice safe sex because it's not hard to contract an STD.